the functioning of civil registration and the production of vital statistics will be an opportunity lost in terms of establishing a systematic solution for ensuring the legal identity for all from birth to death, as requested by the Sustainable Development Goal 16.9. So, in very short, the UN adopted this approach to make sure that all the countries are fully aware of the fact that there is a need to develop and implement this in a simultaneous manner, as to ensure from now on really the access to all the services, to the access to the legal identity for all, universal registration of births and deaths. So this is what we have discussed yesterday. Unfortunately, we have this pandemic upon us, and what we would like to discuss today is how the impact of this pandemic is having adverse effects on the functioning and the maintenance and the operation of civil registration, vital statistics, and identity management. So I will stop here and then go back to Gloria to guide us through today's webinar. Thank you.
Thank you, Sergeant. So I'll just continue up from there to say, today we will be talking about the impact of the COVID-19 pandemic on civil registration and vital statistics systems. And the discussion will be primarily based on a survey that was conducted by the UN Legal Identity Expert Group 2 months, a month ago, I think, looking at the impact of COVID-19 on CRVS. So basically, as a way of introduction, yesterday we talked about civil registration being the continuous, permanent, compulsory, and universal recording of the occurrence and characteristics of important events in the lifetime of people as provided through the regulations of a country. Those 4 features are underlined as key essential features of a well-functioning civil registration system. And when we also spoke yesterday about why we conduct civil registration, and we talked about the value of civil registration at an individual level in terms of providing individuals with legal documents that they can use to prove their identity. We also talked about the importance of civil registration in supporting governments to undertake administration functions, and we also talked about the importance of civil registration as a source of vital statistics. So when we think about COVID-19 and its impact on civil registration systems, one of the things that we think about is its impact on the functions of civil registration and how those affect individuals and how they affect governments in terms of administration and also in terms of vital statistics. So moving on to ask ourselves again, why do we care about the impact of COVID-19 on CRVS systems? Yesterday we said that legal identity is established through civil registration, and that it remains of crucial importance, particularly during public health emergencies. During this time, individuals have to prove who they are, and they need these documents to be able to access public services. Another concern is that during this time, children are exposed to a lot of illegal activity, for example, trafficking, violence, and having identity documents is a key measure in terms of enabling protection of these children. So during this time, we are concerned about how civil registration systems are performing from a child protection perspective. We also know that CRVS systems are the gold standard for measurement of mortality in a population, and at this particular time, it is of interest to understand how well the systems are coping in meeting this particular need, and in supporting governments in managing the pandemic. And then lastly, we also know that the impact of the disaster, of course, is the impact of the pandemic will influence the development of CRVS systems as a whole. We know that many countries have had CRVS plans that are disrupted at this point due to the impact of the pandemic. So these are some of the reasons why we think it is important to understand the impact and to be able to respond accordingly. So in terms of looking at it at a deeper level, the pandemic has three levels of civil registration. It affects the operations of civil registration, and it also affects the key functions of civil registration, like we've talked about. So when you talk about the principles of civil registration, here we are talking about these four components, which are the need for the systems to be compulsory, to be universal, to be continuous and permanent, and to embed confidentiality. And then when we talk about the operations and how they are affected, registration processes are affected, and the resources and infrastructure for registration are also affected. Then I also mentioned about the functions. If civil registration don't perform properly, then from a legal and protective perspective, individuals will be affected, administrative functions of government are affected, and as well as the statistical functions of government. So the UN Legal Identity Task Force launched a global survey whose objective was to assess the impact of the pandemic on the functioning of CRVS systems. And 4 questions were asked. The first one was whether civil registration is an essential service in different countries. The second one was what are the impacts of the pandemic on the registration of vital events and the functionality of civil registration as a whole. And then the third one was what are the working arrangements being implemented or planned to be implemented during this period so that to address the effect of the pandemic and to ensure that there is continuity. And this last one was to ask for recommendations from registrars about how they are addressing the impact and any recommendations they would have on how to ensure continuity during this time. So in terms of the findings, there were 56 countries that responded to this questionnaire, including 4 states of Australia. And in the Pacific, we had 8 countries that provided their responses. And you could see from the pie chart on the side there that 64% of countries responded that yes, civil registration is considered an essential service. Is considered an essential service, and that includes countries in which not all registration aspects were considered essential, but basically some parts, for instance, registration of births for instance, registration of deaths. So, and for 19% of the countries, this was not considered an essential service. Then 17% of countries did not give a definite response as to whether the service is considered essential or not. So, of the principle, permanent, compulsory, universal, and confidential. Most countries reported that registration of some vital events have been suspended. For instance, births and marriages in quite a number of countries. In Uganda, we learned that the civil registration offices were closed across the country. In a number of countries, we learned about the reduction in operating hours of some civil registration offices. For example, Samoa reported that they are now working from 9 to 3 p.m. during the partial lockdown as compared to 9 to 5 p.m. During normal operations. And then, of course, many countries talked about significant reduction in the number of declarations made by members of public. And of course, this is linked to the limitations in movement within a country. Then we also heard from countries like Vanuatu who talked about the potential role that civil registration can be used, the potential role of civil registration records in helping to identify individuals who are affected and their contacts, and thinking through how can that be balanced against ethical standards and measures of privacy and confidentiality. So there are countries that are faced with that scenario where to what extent can civil registration records be made open and available to governments to help support the follow-up and the tracking of individuals that are infected. So in terms of the operations of civil registration, a few countries reported that this is a time where they are experiencing budget shortages and quite a significant monetary impact. In Ecuador, for example, the country explained that the sole income of the civil registration office comes from the issuance of cards and passports, and during this time, then it is difficult to operate because those resources are not coming through. We also had a Sierra Leone saying that they did have quite some amount of funding promised by their donors, which was withdrawn during that time, and which was going to affect how they organize themselves in terms of delivering their registration functions. And then in a number of governments, civil registration budgets were at risk or were taken away to be used to cover the COVID-19 response. So in some countries, there were also difficulties in the distribution of registration materials, such as from the national office to subnational offices, and this is linked to the limitations in the transport and then transport arrangements. And then there are also delays in the transmission of registration returns. For instance, countries that have subnational offices, how those returns are submitted to the national office was affected, particularly in countries where the systems are paper-based. And then many countries were considering revising their registration processes to simplify them, to simplify the procedures and to simplify the requirements that are needed. In Colombia, for example, they usually footprint babies, and they were saying that this will be suspended during this time. Quite a number of countries were thinking about taking away the requirement for fees and reducing on the number of documentary evidence that is required during this time for registration purposes. And then in a country like Colombia, civil registration services had to be delegated to another authorized authority as per their disaster management and business continuity plan. So other adjustments that countries reported were staff rotations and flexible or reduced working hours, an engagement of a minimum number of staff to ensure that we reduce the chances of infection, and staff working at home. Then some civil registration staff were reassigned to cover COVID-19 duties in some countries, and a country like China had a scale down of other services that are offered by the civil registration office. For instance, searching of records and requests for certified copies. These were suspended, and these were reprioritized to other functions. Then most countries reported an increase in the use of electronic platforms. For instance, our neighbors here in Australia and New Zealand. Cook Islands also explained that they are making special provisions that would allow for electronic filing of registration information during this time, which is also quite a step ahead, a leapfrog in terms of how they undertake their duties. And a lot of countries also talked about them partnering very closely with the Ministry of Health during this time to ensure that the events that are happening within health facilities are captured at that level. So we had quite a number of countries placing civil registration officials within the hospitals to support this, the registration of events, and also broadly for registration of deaths. In terms of the anticipated longer-term impact of the pandemic, the first one, we would expect that countries will face a backlog of unregistered events during this time, and of course, that we are likely to see that as the close down measures are withdrawn over the next few months. And then there is also a likelihood that the events that happen during this time might be completely missed out of the registration system. We anticipate that there is likely to be an impact on the vital statistics side of things, with incompleteness of vital statistics or delays or inaccuracies in vital statistics, and also basically suspension of initiatives for improvement of CRVS systems as a whole. For instance, in RMI, they did mention that they had plans to digitize their CRVS system, and this, of course, was severely affected by this pandemic. In Uganda, they had to halt their outreach programs. In Sierra Leone, they had to halt their CRVS coordination meetings due to the effect of the pandemic. And of course, from the human resource perspective, staff are expected to face a high volume during this time. And of course, even within the pandemic, there was quite a lot of, countries did note that there was fear within staff on how to engage at an individual level without getting infected. So these are things that did affect civil registration offices across the globe. So countries were asked to also give some recommendations as to what will they advise other countries during this time. And some of the ideas that were put together was the need for starting to think about creating measures to enable staff to work from home, and which appears to be quite an important recommendation considering the current times and the uncertainties with which it brings. There was a strong recommendation on the need to increase investments in online-based platforms. I'm sure our colleagues from New Zealand and Australia and other countries that have that kind of electronic reporting would talk to how this has helped in ensuring continuity during these times. And then there's that collaboration with key stakeholders, for instance, the Ministry of Health, to ensure that the events, at least that are happening within the health facility, are captured to the extent possible. And then we had 4 countries that talked about having robust disaster management plans, and this did kick in a very important way during this time. For instance, in Colombia, they did say that for them, they just switched to their disaster management plan, which I found to be very impressive. So then the plan certainly does outlay in cases of this kind of an incident, what exactly happens, which staff are assigned to which registration, to which responsibilities, and so on and so forth. Of course, every pandemic and emergency is different, but having in place something that can help us anticipate response is a recommended approach. So at this stage, I'm going to hand over to Sajan to talk about some of the work that the UN has been doing in this regard.
Thank you, Gloria. What we, on top of the survey that the results of which Gloria has presented, we have also put together a set of recommendations that are actually a live document. Those recommendations have been put together with the input from a number of civil registrars and vital statisticians around the world, and quite a few of those are actually coming from the colleagues from your region. So if we go to the next slide, all the recommendations are available on the website that Gloria already mentioned. So what we put together as a set of the UN advice to member states in order to make sure that some of the measures are taken into account to mitigate the impact of the COVID-19 on the functioning and the management and the operations on civil registration and resulting vital statistics. I will list just a few of those. Again, I am quite sure that all of those measures have been put into place in all the countries around the world that are facing, again, the adverse effect on the impact of COVID-19 pandemic in their respective societies. The measures that have been put in place by countries differ, from the complete lockups to the measures that are guiding the social distancing and the banning of major events that would bring together over a certain number of people, to the fact that all the government institutions and the administrative services have been instructed to work from home, and that to try to actually maintain their operations in a manner that has not been tested before. So in order to provide some guidance and some advice to the countries, the UN Legal Identity Agenda Task Force which is co-chaired by the UNDP, UNICEF, and the UN Department of Economic and Social Affairs, put together this set of guidelines, just as a kind of, I would say, hands-on advice to countries they might consider in order to develop some of the mechanisms that would help them tackle the issue of ensuring the universal registration of all the vital events. So first would be developing a guidance note, and this is something that we have witnessed through the survey that, again, Gloria has mentioned. A number of countries developed, aside from the regular routine procedures, a set of guidance note that provides an unambiguous guidance how the civil registration services should operate within those confines that are made necessary by the COVID-19. Some of those activities or actions refer to modifying the operational arrangements. For example, we do know that in many countries there is a very strict list of eligible informers of vital events, and in the case of this pandemic, of course, this needs to be revisited, and perhaps as one of the measures to cope with the impact, expand temporarily the list and eligibility of informers, particularly for vital events occurring outside the health system institutions. If the documents are missing, there should be in place some waivers that would require those documents to be submitted at a later state, but then that the registration takes its own course as if those documents would be available. Of course, it is also the ensuring the access to the registration of vital events and the robustness and trustworthiness of vital records and certificates. Fees. As already mentioned by Gloria, there are a number of countries that are feeling very strongly the impact of the late or delayed or non-existent registrations as a lack of fees that finance their functioning. But then this is where the government should step up and suspend the fees and make sure that the financing and the budgeting of the civil registration is taken care of without those fees imposed on the population. And if we move on the next slide, we is also we are referring in those guidelines, in those recommendations, a necessity to plan for handling the expected backlog. We are fully aware of the fact that that has been documented in the survey that a number of countries are struggling with registering all the deaths as they occur, and the peaks are to be expected, especially for that registration during the pandemic. But also the backlog in birth and marriage registration needs to be addressed because they will inevitably follow as the births, especially those occurring outside of the health institutions, will have to be registered late or with as delayed. The online provision of services is certainly a way of ensuring the functioning of the civil registration in those times of pandemic in the less intrusive and the most efficient manner. However, it is not the case that in most of the countries those online provision of services are put in place in time, and those now that are being put together for the purpose of supporting the lack of the physical contact and the physical approach to the civil registration authorities needs to be tested and needs to be fully put within the confidentiality and privacy protection standards that are so routine when it comes to the physical registration of vital events. On top of that, this is one really opportunity of making the case for digitizing the civil registration in order to make sure that next time such kind of disaster happens, there will be a possibility for the population to report on the occurrences of vital events using the online facilities, thus making the registration process straightforward, most efficient, and really non-intrusive in terms of exposure to in this case, to the pandemic of this virus. There will be a lot of backlog. There will be a lot of delayed registration of births and deaths and marriages. And of course, as we all know, in most of the civil registration laws, we will have a specific regulations that are mandating the fees, the late registration fees being imposed that will cover the additional workload on the civil registration authorities. So in this case of pandemic, in this case of really disasters, our recommendation, the UN recommendation, is to waive those late registration fees. The public outreach is critical. There needs to be regular communication with the public, informing them and instructing them how to register the occurrence of vital events and how to get the best of the services that the government is mandated to provide. And this cannot be really overemphasized. The interaction with other government institutions is critical, primarily the statistical office, and we will discuss tomorrow, during tomorrow's webinar, how this the assessment of the impact of the COVID-19, and not necessarily COVID-19, but disasters in general, needs to be measured in order to have a clear understanding what are the consequences of not having a universal civil registration that results in comprehensive vital statistics and legal identity for all. So this is all the set of the recommendations that actually guidelines that has been put together, in terms of maintaining civil registration during the COVID-19 pandemic. It is available on our website, and I will not go into more details on it. I'm quite sure that in all your countries, some of these have been already put into place. The purpose of this is just to put this on the table, making sure that the governments and the civil registration authorities live to the moment and make sure that they are able to deliver the services as they are supposed to do, even in this case of the pandemic that has been put upon us. I will stop here. Thank you. Gloria?
Oh, sorry. I'm sorry. I wanted to mention that right now we would like to open the floor for discussion, in particular with regards to the responses that we received from countries on their thoughts about the COVID-19 pandemic and the impact it has had on their CRVS systems. In the Pacific, certainly we've not been affected much in terms of actual deaths, but the limitations in public movement, of course, has had an impact on how people are able to declare their events. So I'd like to open it up to countries to share any thoughts about, has there been any changes since the last reports with regards to the impact that the pandemic has had on your civil registration operations? So feel free to take the floor. We can go in alphabetical order. If you don't mind, Cook Islands, would you like me to put you on the spot? Any thoughts from Cook Islands? Should we just do a random round? Just inviting any thoughts from countries on.
Okay, kia ora everybody, kia ora Gloria. Not many changes from the last reporting. It's just that for our marriages, we didn't have any. I think last week we just had one marriage that happen here in the Cook Island. Otherwise, everything has slowed down, and the flow of customers have also slowed down. But the registration of death and birth are still going. So otherwise, business, I think it's business as usual for us back home, but most of the staff are working from home.
Thank you, Rimel.
Did you get that from me?
Yes, we did. Thank you very much. That's very comprehensive. Thank you so much. Should we go for RMI? Any thoughts from Marshall Islands? Okay, some more. Any thoughts from Samoa? New Zealand?
No particular thoughts from us. Our volumes have been pretty much the same, mainly because they're all online. Some of our smaller services, we've got a little bit of a backlog for things like adoptions, name changes, things like that, because we didn't have all of our staff in the office. But now that most have returned, they're working through those backlogs. Yeah, so it's pretty much business as usual. Obviously, a drop off in marriages because we no longer have international tourists, much like the Cook Islands, coming over for their weddings. And there's been a reduction in the number of people who can attend the ceremony as well. So there's been a reduction in domestic weddings also as a result of that. But other than that, it's pretty much business as usual.
Thank you, New Zealand. Thank you, Jeff. Niue? How are things going in Niue?
Flaflayet to Gloria. For us, our number of events have declined, mostly because the people have left overseas and they have occurred mostly in New Zealand and they can't come back. So we know of a few deaths that have occurred in New Zealand during the time of pandemic, and because we cannot bring the body back, we're not able to capture that. So I think that's probably our main issue here. Thanks.
Thank you, Noma. Vanuatu? Palau?
Hi, good morning. For Palau, it's been business as usual. We haven't had a reduction of business hours. The only thing is back in April, from April 2nd to April 17th, the court closed down for deep cleaning and sanitizing the premises. So I believe that created a backlog at the Ministry of Health because they were not able to transmit the births and death certificates to the court. But other than that, when we opened on the 20th, it's been business as usual. So I believe whatever backlog was created for the 2 weeks has been caught up.
Right. Thank you, Palau. Australia?
So if I give a report for Victoria, so obviously this is all run state and territory. So Victoria, births and deaths have remained consistent. Marriages have significantly dropped off due to actually mainly because the Victorian Marriage Registry, which is us, conducts about 20% of the weddings across Victoria, and we've stopped operating. Relationship registrations have significantly dropped because a number of those are done for partly for visa purposes and people aren't traveling anyway. And then things like change of name have also dropped. But other than that, main events, births and deaths have remained consistent and the same.
Thank you, James. Any other thoughts from Australia? Yeah, sure, go ahead.
And in Tasmania, yeah, pretty much the same as James has explained for Victoria. There's been a decrease in marriage registrations because of the restrictions of the number of people who can attend, but we've managed to continue with other registration activity, and it's really been business as usual.
Thank you, Tasmania. Thank you, Anne. And Tonga. Tonga. CNMI. Any thoughts from CNMI? All right, colleagues. Thank you. I think it's any thoughts from CNMI? Sorry.
Hi, Gloria. This is Eden from the Marshall Islands.
Right.
Yeah, I'm so sorry about earlier. For the Marshall Islands, right now we don't have any cases of COVID, so pretty much our office hours are the same and activities are the same. But we're on the preparedness and we're in the preparedness mode. So we have certain condition categories that when we do have COVID, we will follow a certain protocol. Thank you.
Thank you. So does that mean you have a plan, a disaster management plan of some sort?
Yes, we do have RMI COVID-19 response plan, preparedness and response plan. And I think what we answered on the civil registration, we're working on tweaking and finalizing the area for CRVS.
Thank you. Thank you, Aitlan. So, colleagues, thank you very much for sharing those thoughts, which kind of gives us a good summary to the webinar we just had on the impact of COVID-19. Of course, we continue to learn, and since we do not know how far the pandemic will go, we will continue engaging on this topic. And please feel free to update us on any changes that you think are significant and that you'd like to share with civil registration officials from other countries. So just to summarize and to give you a heads up as to what we will be up to tomorrow, which links up to the last part of our discussion today. Tomorrow, we would like to go through kind of an assessment of the impact from a quantitative perspective of how our civil registration offices have been affected in terms of registration of vital events. And so we did share with you our document just before we started off the webinar, which I will project now. And tomorrow we would like to have a very interactive session, basically to hear from you about your experiences in terms of assessing the actual impact that the pandemic has had on your CRVS systems. And the questions that we will be looking at, sorry, I'm having a delay in getting the document uploaded here, but the document that we'll be looking at is already in your inbox. Says we will have six questions that we will be looking into. And the first question is we will be talking about the possibility of comparing the number of deaths that you registered in the first 5 months of 2019 to the ones that you'll be registering this year. How do those compare? And are we able to see how do those two numbers compare? Of course, it is in an indication of the workload that we will be having in the remainder part of the year, but it will be good for us to see from a practical perspective, how do the numbers that you registered in the first 5 months of 2019 compare to those in 2020? And the similar case for births. And then we will also have an assessment of the same for marriages. And then the fourth question that we will seek to discuss is your civil registration system able to generate statistics based on the date of occurrence as well as the date of registration? And then we will look at whether we will discuss whether is the civil registration system in your country digitized. And lastly, we would like you to share with us about your initiatives over the next, your forthcoming initiatives or your planned initiatives to improve their CRVS system, kind of your short-term and long-term plans towards the development of your CRVS systems. So these questions, we've shared them in your inboxes and you'll find them. And we really hope that we'll be able to have an interactive session of learning from you tomorrow of what are your plans and how do your numbers compare for last year and this year. I see a hello from Samoa. Hello, Samoa, please take the floor. Hello, Samoa. Yes, we can hear you.
Hello, everyone. I've been trying to experience some technical fault infection. Just wanted to brief contribution what other countries did earlier. Samoa, as you may all know, that Samoa with free, one of the COVID free, we did go lockdown. But since last 2 weeks, most of the conditions and business are back to normal. Hours from 9 to 5, and the registration we had the impact on birth registration during lockdown because public lockdown. At the moment, everything is back to normal. We experienced public coming in. One of the major impact in the registration based on previous experience and the past trends. May is always the busiest month, more because of water. But as you may all aware that the new because of the pandemic, that's major not only the registration wise.
Sorry, Pony, I struggled to hear the last part of your intervention. Do you mind going through that again?
I was trying to share that April, based on the past experience and the normal trend, April every month is the busiest month in the registration because of the New Zealand quota. That scheme where Samoan citizens apply for New Zealand citizenship, that quota scheme.
Right. So have you observed any declines in that?
Because the New Zealand quota scheme has been postponed, so there was nothing going.
Yeah, thank you. Thank you so much for sharing that, Pony. Thank you. Okay, thank you so much, Pony. I think these experiences are really interesting and they do help us to build learnings about what to expect in the future. So I was just sharing here that tomorrow we are looking forward to an exciting session from you where we would like you to do a bit of homework, not in a very deep way, but it will be nice for you to just have a look at the deaths that you registered last year at a similar time and the ones that you registered this year. And it will be nice for you to have the numbers for those, for births, for deaths, and for marriages, to be able to really compare the impact from a quantitative perspective. And then on to the fourth question, it will be nice for you to share with us whether your civil registration system is able to generate statistics based on the date of occurrence as well as the date of registration. And then number 5, is your CRVS system digitized? And if you can tell us what platform you're using, that will be very useful. And then the last question that we would like to hear from you is about your upcoming projects in relation to civil registration, vital statistics, and identity management. So basically, tomorrow we would like to give an opportunity to every country that will be joining to speak. It doesn't have to be a PowerPoint presentation, no, just a sharing of what is going on in your country in regards to these 5 questions. I think that is all from my side, and we really do look forward to learning more from you tomorrow. Sajan, would you like to have some remarks to make?
No, just to emphasize that we are looking forward really to discuss, to have your substantive inputs tomorrow around those themes that we are putting on the screen. I believe that also that will enhance very much the exchange of knowledge and experiences between your own countries and your own collegial arrangements that you already have put together with the Brisbane group. I believe this is really very important, and this is a way of building up synergies in order to make sure that we are learning from each other and that we are implementing the solutions and using the lessons learned that have been tested elsewhere. So I'm looking forward tomorrow to hearing from you around those themes and to see how we can essentially make sure that we are working towards the full implementation of the UN model for civil registration, vital statistics, and identity management. So with this, I wish you a successful day. In the Pacific, it is night here, and looking forward to talk to you tomorrow. Have a good day.
Thank you, Sajan. Thank you. Sorry, can we just hear from Hafiz, who's raising his hand? Yes, Hafiz? Hello, Hafiz. Okay, we'll take that to be an error. So thank you very much, everyone, for joining us and being a part of the discussions and contributing. We trust that you've found the session interesting, and we will be very happy to connect with you again tomorrow at the same time for our last webinar. So thank you so much.